Welcome back to Winging It Buffalo Style. Today in the hot sauce, November is National Lung Cancer Awareness Month, and as we're entering the first day of the month, we thought we'd sit down with an expert to find out a few facts, truth from, fiction about lung cancer, because of course it is one of the most dangerous diseases out there.
And we have Dr. Mark Hennon here from Roswell Park Cancer Institute, and you are doing a lot to raise awareness for lung cancer awareness this month.
Absolutely.
Tell us about the Breath of Life celebration.
So the Breath of Life celebration is it's being held next weekend on Saturday, the 9th. It's basically a get-together for survivors of lung cancer and their families or friends or relatives to basically build awareness, build support around lung cancer and lung cancer survivors.
And when we start talking about any disease, especially cancer, I feel like there's a lot of myths out there. There's a lot of statements that people hear all the time that may be true, but they may also be false. So, of course, just like we did for breast cancer awareness, we wanted to, do something a little bit lighter because, of course, the topic is so serious. And we have, Lauren and I will guess if it's true or false after we read the sort of fact or statement that you're going to present to us. So let's get right started. What is number one?
All right, number one. Lung cancer grows subtly for years without noticeable symptoms.
You both said true.
Both said true, and the answer is true. Lung cancer at its earliest stages often has no symptoms. So you should see a doctor if you do experience things like chest discomfort, a persistent cough, fatigue, or weight loss, because these can all be potential symptoms of lung cancer.
So it's one of those things that once you start noticing symptoms, even if you're not sure what it is, you really want to be proactive and get it checked out.
Be proactive and get it checked out.
All right, what about the
question.
second one?
Second question, living with a smoker but not smoking yourself doesn't cause lung cancer.
That's tricky because it's one of those double negatives. I think that it's secondhand smoke, right? That's what you're asking
Secondhand smoke, exactly, and the answer is false. Simply living with a smoker increases your risk of coming down with lung cancer by 20 to 30%. Wow. And each year, upwards of 3,000 people die that are non-smokers that have come down with lung cancer.
So when you quit smoking, it not only is so good for you, but everyone that you're around, too, really.
Absolutely.
It's a gift to everyone that you're with.
Well, it's definitely a driving factor right there. What about the third one?
The third one, so once you reach a certain age, there's no benefit to quitting smoking.
I would say false. I think there's always a benefit.
Wrong.
Yeah. Exactly right. It's false. So if you quit at any age, you're going to be doing something good for yourself, and you're going to be reducing your risk of lung cancer as well as other cancers. And so even if you've already been diagnosed with lung cancer or another form of cancer, quitting smoking helps you tolerate the treatments better, prevents certain complications such as pneumonia, helps you get through surgery if you need that. So quitting at any age is a benefit.
Is that a common thought with people who maybe are of a certain age and still smoking? Do they say it doesn't matter for me anymore? Is that something that you hear your patients say?
Unfortunately, I do hear that, and I think obviously quitting is difficult, so I do hear it.
All right, let's move on to the fourth and final question.
So the fourth and final question, so basically, more people die each year from lung cancer than from all other major cancers combined.
You saved the hard one for the end.
I'm gonna go in between. I don't know.
Heart disease. I feel like
just cancers. In terms of cancer. So actually, this is true.
Oh,
so lung cancer, it's not as common as some of these other major cancers like prostate, breast cancer, but it kills more people every year. So it's very mortal.
So I can imagine the major thing is, of course, getting screened, but also that quitting smoking if you are a smoker. For non-smokers out there that want to make sure they're doing everything right to be as preventative as possible, what can you recommend to them?
For non-smokers, keep doing what you're doing. I mean, smoking is associated with so many health problems and so many risks in terms of a cancer standpoint. To be aware of the other risk factors that are associated with it, such as asbestos or radon or secondhand smoke, is probably the best thing you can do.
All right, thanks so much, Dr. Hennon, for coming in today from Roswell Park. If you would like to learn more about the Breath of Life event, the website is roswellpark.org/breathoflife. All right, thanks again.
Right, thank you.
Time to